I'm going to share with you how I examine a wrist. It's the way I do it, and I expect that each of you will learn how to do it your own way and work out how to work through the wrist the best way for yourselves. The wrist examination is the most important way to find out what's causing a problem in the wrist, but it needs to be considered in the context of the history, medical imaging, be it functional x-rays, CT scan, MRI scan, and with increasing importance the ultrasound. And in fact, in my world, over the last 1 to 2 years, the ultrasound has become almost indispensable for working out what is happening in the wrist. There's no need to guess. You can actually see living anatomy moving in real time. Another way of looking at the wrist is with a hand upper limb evaluation. That's the term I use, and that's a system of measuring the angles in the wrist, but more important, the power and function of the wrist. And that's using a J-Mar dynamometer for gross grip, pinch meters, and more importantly for the wrist, force place, to see how much force people can place on their wrist while weight bearing on the dorsiflex wrist, and dynamometers to measure pronation and supination. So when you've got all that information, you can hone in with your wrist examination to work out what is causing the problem and what is the diagnosis. And again, another segue. As time evolves, wrist arthroscopy is becoming increasingly important. There are many things that are outside the resolution of all these avenues of assessment. It's only when you look inside the wrist that you can work out what is happening and what the final diagnosis is. So it's all about getting a complete information base to get the best possible and most accurate diagnosis. Before you even start a wrist examination, ask them to put a finger on where they feel the pain. First thing is to look at the back of the hands. And what we can see here is a prominent ulna and a supinated carpus. Look at the ulnar side of the wrist and the hands, and then check the range of motion. And you can always tilt them up a bit like this to see just how mobile they are. And there's a little bit of hypermobility there. Drop your elbows. And again, we tested palmar flexion. And we put the hands by your side. Does that hurt when I do that?
A little bit.
Something like that. Does that hurt there?
Yeah.
So we know that there's a DRUJ problem. Now, if you bring your elbow down onto your thigh like this relaxes the forearm. So here we have trapeziometacarpal joint grind test. It's smooth. Triscaphoid joint, scapholunate joint, third extensor compartment, triquetral-lunate joint, pisiform triquetral grind, triquetral-lunate allotment. Then come across the mid-carpal joint. Push the thumb into the palm and you can do a Finkelstein Chest. Now this is doing lots of things at the same time. I've got my fingers on top of the proximal intersection, over the first extensor compartment for the quervains, over the distal portion of the EPL looking for distal intersection syndrome, and at the same time we're testing for ulnar carpal impaction. Follow the carpal joint shift, smooth emplication over here. Same on this side. Okay. Bring the arm up, pronate it to lengthen the ulna, and we know the pisiform triquetral joint's okay. We know the triquetral-lunate joint's okay. So we can push up on the pisiform and ulnarly deviate for an augmented ulnar carpal impaction test. Then bring the wrist around like this and look at the ECU move. We can see the ECU just here, and then push down as hard as you can this way. And here you can see the ECU, it looks like it's subluxing. And then if you relax, it's not clicking in and out or snapping, but the only really reliable way, in my opinion, to examine an ECU is to use an ultrasound. And now this is really tricky. You've got to hold incredibly tight. See how my fingers are blanching? And what we're doing is we're going to move the radius and the wrist on the distal ulna. The distal ulna doesn't move. Can you see the instability there? So if you do it loosely, look at this. That's just the hand and the radius translating on the ulna. You've got to hold the hand and the radius together really, really tight. Now this can be incredibly subtle, but an imperceptible movement is a big difference, particularly when you compare it to the other side. Make a fist quickly, open, and check for an Allen's test, and just check the ulnar nerve. A wrist examination should take you 1.5 minutes. It's important to do it regularly so it becomes second nature, so you're not thinking about each movement. What is just as important about a wrist examination is to know what is normal, so that the things that are abnormal will stand out and crystallize in your mind as you're doing them.